As advocate care has evolved, we recognize the need to focus on skilled nursing facilities, especially as we're getting into Medicare shared savings and Medicare Advantage. In contrast to the old way of doing things with just having patients assigned to somebody who wanted to work at the skilled nursing facility or an attending who would show up the minimum amount of times, we've put teams in place in the skilled nursing facilities with a physician who is expert at taking care of skilled nursing facility patients supported by an advanced practice nurse. Together they're on site at least 5 days a week and round on patients 2 to 3 times a week depending on patient need. And probably even more importantly, if there's a change in the patient's condition, one of them are available to reassess the patient and change the treatment plan. We now have about 1.5 years worth of experience and have brought the program to more skilled nursing facilities in more of the advocate hospital service areas and have truly seen marked improvements in care coordination, reductions in complications and readmissions, and that's what we want to talk about.
As physicians, we always try to give the best care to our patients. But in a busy practice with having to see both inpatients, outpatients, and also seeing our patients at the skilled nursing facility, it's very difficult to juggle the time to give them the proper medical care. And I found in my practice that I was doing a disservice to my patients because I was not able to be at the nursing home at the times that they needed me for care. So the post-acute network was very attractive to me because I knew that this was going to be a quality program that would give quality care to my patients. In the past, when I would refer a patient to a skilled nursing facility, very often I would have no knowledge of what happened to that patient in the nursing home. It was like a black hole swallowed them up. With our post-acute network, that helps improve the continuity of the patient's care and the continuum of care because I am informed of that patient when they're in the nursing home. Also, when that patient is discharged from the skilled nursing facility, there's automatically an appointment made in my office to see that patient within a week of their discharge.
My role at the skilled nursing facility is I manage patient care of patients that leave the hospital. I'm able to be the first responder typically to any sort of issues that arise with any of our patients. And we have a team between a nurse practitioner and physicians where we visit these patients on a regular basis to treat any sort of acute issues and to be able to be available to the staff when things occur, as opposed to them having to wait for a physician.
The question really is also how do patients perceive the quality of care they're receiving, and you know, far and away they're going to be happier when they feel cared for, and they're going to feel cared for when they're seeing someone from the team that's seeing them frequently and could react to their immediate needs. So I think having an advanced practice nurse on campus in the facility full-time dedicated to meeting patients' needs. In addition, she's there to be a very effective communicator with patients and families. In the past, nursing homes have been kind of an isolated part of the system. It's now going to be, I think, one of the centerpieces of new systems that are being developed.
Since we've had nurse practitioners in the skilled nursing facilities, I have noticed that there have been less amount of patients going into the hospital being readmitted. We're fortunate enough to be able to spend our time there, and we can address issues if a patient is dehydrated or has like a urinary tract infection. We can order those labs and treat the patient immediately before they develop any more serious symptoms. Typically, most patients respond pretty well to treatment and then avoid having to go in and out of the hospital.
The post-acute network skilled nursing program offers a lot of benefits to all of your patients. We've seen a significant improvement in length of stay and a reduction in hospital readmissions, and obviously that means fewer complications. No patient that I know ever wanted to be readmitted or to spend more time in the skilled nursing facility. But probably even more importantly, it's created some improved flexibility. We're able to directly admit patients to the program from home if that's appropriate, or from the emergency department, so that they don't need to spend a couple of days in the hospital and go through that cycle, which we're all too familiar with from the past. When it's time for the patient to leave the skilled nursing facility, the added benefit is that their care is redirected back to the Advocate Network. That includes for home health services, for outpatient diagnostics, and most importantly, they come back to their Advocate primary care physician, and all of their data and information is available in our electronic health records.